I don't believe, controversially, that to be really good as an aesthetic clinician, it's something that you can maybe do part-time. It became very apparent that aesthetics is unique in that a lot of places will put profit and business before patient care. It's seen as a beauty treatment until it goes wrong, and then it's a medical problem. There's something about seeing the transformation in a patient's confidence when you do these treatments that is just incredible. And quite early on, I think that's what I found really exciting and really electric.
Dr. Ben, thank you for joining us on the sofa today. We're really excited to have you.
Thank you for having me.
Yeah, so we're going to go straight into it. We
Okay.
always start with like a little warm-up round. So it's your first initial thought, your first initial answer. You can always explain your answer, but just give me your first thought that comes to mind. Okay. Injectables or energy-based devices?
Oh, it's hard. Injectables, because I like doing them.
Okay, nice.
Yeah.
Oh, packed A&E waiting room or back-to-back aesthetic patients?
Back-to-back aesthetic patients.
Was that an easy one?
Yeah.
I feel like that's like a mentoring or treating.
Oh, always treating.
Nice. And scaling quickly or steady growth?
I should say steady growth, but it's not what I've done. So scaling quickly.
Nice. I have to ask that question as well, because I think we get into it a bit about how you started your clinic and all of that. But when you started essentially doing treatments, did you think you were going to have a clinic as quickly as you did?
No, I didn't.
So that was never on the cards initially?
It was maybe on the cards, but definitely not as fast as it happened.
Yeah.
And when I started, did I think we'd be where we are now? Because I started less than 3.5 years ago. No, I didn't.
It's amazing though. It's an amazing sort of feat to be able to do that in quite a hard climate as well.
I mean, some luck. And it's not just me. I've got a very good business partner. I always say I'm a very reluctant businessman. He is a very good businessman.
Nice.
But no, I didn't. So I would have definitely planned to be steady, but it didn't work out that way.
Oh, I think you've done well either way. So all
Thank
good.
You.
So for those of us, or for those of you who don't know you, Dr. Ben, tell us about yourself. Tell us how you got started in your journey.
So yeah, I'm Dr. Ben. I'm an aesthetic medical doctor based up in Edinburgh in Scotland. I'm obviously not Scottish, so I'm from England originally. I actually studied in London, but moved up to Scotland straight after med school. And my background is as an A&E doctor, actually. And I never planned to get into aesthetics. It was always something I was maybe a bit interested in. I started to have a couple of treatments myself. I was very open-minded to it. Found that I was suddenly got quite fascinated by it when I became a patient having aesthetic treatments. And me and a friend one day, as I imagine a lot of doctors' journeys start, said, oh, why don't we go on this injectables course, which turned out to not be very good. I had to go back and do some others.
Wow.
But I just totally got bitten by the bug. I loved it. But it wasn't something I was expecting. I kind of fall in love with. And then when I did, I kind of thought, oh no, this is going to maybe take over my life. And it has.
Mm-hmm. Yeah. And I mean, yeah, we can get into it. Look, there's so many questions I have around how you juggle everything, and you are like a Superman in that.
Oh, really? No. Just lots of caffeine.
Well, either way, it's impressive. So let's rewind a bit to medicine and why you started it in the first place. So what pulled you into medicine full stop?
The short answer is that I was at a school with, there was actually like a performing school. So all of my friends, we were all musicians, and all of my friends from school went on to be kind of classical musicians and all of that. And I realized that because I was surrounded by people going to do that, maybe that wasn't quite for me. I was enjoying it. Again, I wasn't one of those people that wanted to be a doctor from, day dot. I wasn't really sure. I thought maybe I could do medicine because I liked science and I was doing sciences at school and I quite enjoyed them. And then our kind of careers advisor person, basically at school, I was a bit alternative, maybe, bleached blonde hair, maybe went through a bit of an emo phase. There are some photos buried deep on the internet somewhere. But the careers advisor person kind of said, oh, maybe you're not the type of person that would get into medical school. And I have quite a deep competitive streak, as I think a lot of healthcare professionals do. And I remember just thinking, oh, for goodness sake, now I feel like I've got to prove that I can.
Wow.
So then I did get into medical school and I thought, well, I may as well go. And again, kind of like aesthetics, it was never something that was my grand plan, but pretty much straight away, I just thought, this is amazing. Yeah. I don't want to do anything else. And there's nothing I'd rather do than being a doctor. I love it.
Love that. That is mad that someone actually said to you, based on...
In a nice way, but just thought, I think trying to manage my expectations maybe, but it kind of ignited this fire in me and I thought, oh no, I know I've got to prove these people wrong.
And I guess now you can thank them for it.
Yes, true.
You would have been like, meh.
I've not seen them, but if I did, maybe I would.
Thank you for questioning me. It worked out really well. That is hilarious. So obviously that's sort of where you all started. And then you said obviously getting treatments was sort of what kickstarted the aesthetics. But back when you were studying, was aesthetics as sort of prominent as it is now? Because I feel like,
no.
Yeah, that's something I'm noticing, that with younger sort of medical professionals or coming into it or studying, aesthetics is now.
It's a thing. I get messages several a week now, I think, from either medical students or doctors at the very start of their careers asking for advice, which I think is great, because actually I think it's a wonderful specialty to come into. Specialty is a difficult term because it's not regulated. I'm sure we'll get onto that. But I really like giving advice to people because when I started, it was a bit of a, it was a bit of an odd, how do I do this? No, so when I was at medical school, it wasn't really a thing. I've always been interested in skin. I've always been interested in, I guess, kind of the idea around that and confidence in people, coming from a performing background maybe. But no, it wasn't something that was really on my radar at all. I kind of wasn't sure what kind of medicine I wanted to do. It wasn't until after I graduated that I found I really enjoyed A&E and kind of started to go down that road, and then found aesthetics by accident.
That's so interesting. So aesthetics and then A&E, which we need to talk about because I feel like that's a whole piece in its own, but I'm going to get to that in a bit. So was there a moment when you knew that you were going to basically take this to the next level and start your clinic? And you said you've got a business partner, but was there a moment where you were like, I need to do this as a business versus just doing it sort of on the side or having a room?
I think quite early on, partly driven by circumstance, partly driven by a realization that to do it well, I think you need to do this a lot, or start doing it a lot. I don't believe, maybe controversially, that to be really good as an aesthetic clinician, it's something that you can maybe do very part-time. I think you have to do it enough, like anything. And then also circumstances in Scotland, we are more regulated in England in some ways. So for healthcare professionals, in order to do it, you have to do it from a very regulated premises. So in England, anyone can do it anywhere, rightly or wrongly, probably wrongly. But in Scotland, if you're a healthcare professional, you have to do it from a premises that's been through quite a lot of regulation. So I think the barriers to getting started in Scotland are maybe higher for clinicians. Interestingly, if you're not a clinician, you can do it from anywhere in Scotland. So there's a bit of a mismatch with the rules there. But so we kind of had to find a space and almost make the decision of, okay, are we going to do this? Which was a bit scary, but we did, and started part-time. But, as with anything, it kind of grew.
So if we talk about sort of the clinic now, so founding the Stockbridge Clinic in Edinburgh at a relatively early age, or early stage in your career as well, let alone age, why do you think that you felt confident enough to do that in such an early stage of your career?
I wouldn't say I did feel confident enough to do it, but I just kind of did it. Which maybe sounds a bit silly, but when I started, I briefly worked in another clinic, a chain clinic that will remain nameless, and didn't love it because I felt like I didn't have any autonomy, or limited autonomy, over what I did. It became very apparent that aesthetics is unique in that a lot of places will put profit and business before patient care. And I quickly realized that outside of my own clinic, or at this point I didn't really have one, I wouldn't have full autonomy and control over what treatments I offered, what products I was maybe injecting into people's faces. Obviously I could say no to doing a treatment, but I couldn't be confident that the values I wanted to base my practice on were at the core of what we were running. So I, in discussion with a friend, one of my close friends, Jack, who is another doctor, and we kind of thought, okay, maybe we'll do it. And again, it was kind of circumstance. I thought, if I want to do this, I want to do it properly. So we started what has now become the Stockbridge Clinic. We rebranded at the start of this year when we grew and moved to a bigger space. And by some chance, it has worked out.
No, it's worked out really well. And you mentioned the type of treatments that you offer. So what did you start with? What was your sort of core offering when you first opened?
I think, like everyone, injectables, anti-wrinkle treatments, so neuromodulators, dermal fillers. Started dipping our toe into some skin improvement treatments. And I think as we started to offer more, as the patient base grew, as I learned more as well, because what I know now is vastly greater to what I knew when I started, and I'm sure what I know in 5 years will be greater than what I know now. As we learned more, the treatments we felt we could offer obviously grew.
Yeah.
But we started, like everyone, I think, offering kind of injectables, which I think still is a lot of what brings people through the door of an aesthetics clinic.
Yeah, that was going to be my next question. What is it still very much sort of the most popular treatments, or is it
not always? We now do a lot of skin, we do lasers. I was talking at a conference recently for Cutera, so we've got some of their lasers, and laser genesis, one of their treatments, we realized is the second most popular treatment after anti-wrinkle injections, which is wild. And I was so taken aback to see that over the summer as well, which felt a bit crazy to have a laser treatment that popular then, but it was. So no, obviously injectables still form a huge part of what we do, but we offer so much more now, which is really nice as well to have that kind of holistic offering to patients.
And do you find that you treatment stack quite a lot because now you have a very
so kind of if by that you mean holistic kind of treatment planning, multimodal, definitely, because patients rarely come in with one concern, or if it is one concern, it's rarely just going to respond to one treatment, and sometimes to get the best outcome for patients, we can use different modalities, and it's nice to be able to offer those.
And what would you say is your sort of clinic, or I should say patient demographic? Is it quite varied in age, or do you see more sort of millennials coming up doing treatments now?
Maybe more, I'd still say the majority of my patients are kind of late 30s plus, 40s maybe. I know that as a clinic, we have more male patients than the average. I think we're about 20% male patients, 80% female, which I believe is higher than the national average. I can't remember what the statistics are, but I think it is higher.
It definitely is.
So we actually have a really broad mix, and I think that's diversified as we've increased our offerings. Not everyone wants injectables. Some people want lasers, some people want injectables, some people just want skin treatments, some people want, we do a medical weight loss clinic, and we're expanding our kind of wellness offerings next year. People want different services. So I think as we've grown that way, so has our kind of demographic.
That makes sense. So what has been your proudest moment so far? And equally, what has been the moment where you thought, what am I doing?
Well, it's probably two edges of this kind of, it's two edges of the same coin, really. So the proudest moment was definitely opening what is now the Stockbridge Clinic, which we opened at the start of January of this year, 4 months behind schedule, which felt terrifying. It's over 2 floors. We've got 4 clinic rooms. We went from 1 clinic room to 4 clinic rooms. Went from a team of 3 of us to a team of what's now 9. So whilst that felt more terrifying than I can tell you, it was an immensely proud moment. It's probably just the first kind of finishing the first day doing clinics there, seeing patients that I think were as excited as me to see it as well, because these were people that had been seeing me for a while, and I'd shared the stresses with them of saying, oh, we're going to be open soon, and then no, we're not quite open yet. And equally, probably the most stressful moment was, there was a moment a couple of months before that where we genuinely thought we might not be able to open it, and that was November last year. Was a dark month.
Oh gosh.
Again, with the regulation in Scotland, it was fine, but it's very strict, and there was a long back and forth about, would you believe it, all the clinic rooms were fine, everything was fine. It was about the exact size of a toilet and whether, by different definitions, whether it counted as wheelchair accessible or not. And that is what delayed us getting our kind of healthcare approval by over 3 months.
Oh my goodness.
And there was a dark moment where I thought the only way around it was going to have to be to put another toilet in the middle of the waiting room, which I didn't want to do. And luckily we didn't have to do. But yeah, that was I think looking back now, it sounds funny, but at the time we'd invested so much and taken such a risk that the idea that we couldn't, it just wasn't an option at that point. I just thought, I can't. If this doesn't work, I don't know what I'll do.
I feel like I can relate on some level, not quite the same, but I have been through the whole waiting for planning permission and waiting for things to be signed off, and it's just the most stressful thing because physically
it's out of your control.
Yeah,
it's out of your control, and it was very, very it was very stressful. And I think me and Jack, my business partner, we joke now, we'd kind of take it a week on turn. One of us would be have it together and be like, it's fine, we're optimistic, this is happening, whilst one of us was having a bit of a breakdown, and then we'd swap. And then I had to take 2 months off that month to have an operation. And I remember just like lying there in bed trying to recover, just thinking, this has to work.
Yeah.
And it did. It did.
Yes.
I can look back now and think, thankfully it did.
And not too far off a year soon, so you'll be able to celebrate a year.
Yeah, that's crazy to think that it's been, I mean, that's mad.
It is mad, isn't it? Especially this year. I feel like everyone says it every year, and we all do, but this year feels like it's flown.
Yeah.
And I'm sure for you, it must have felt like it's flown.
It's been a bit of a whirlwind.
I bet. So what or who influenced you the most in terms of aesthetics particularly? Was it a mentor? Was it yourself? Was it your business partner? What like sort of inspired you to I don't know, do what you're doing now and be as successful as you are now?
It maybe sounds a bit cheesy, but genuinely some of my patients, I was thinking about this recently. I mean, there's all these incredible names that we all aspire to, you know, these incredible aesthetic clinicians that anyone on this podcast is going to say they look up to, right? And, you know, some of whom I'm lucky enough now to call colleagues and friends, and that's amazing. But there's something about seeing the transformation in a patient's confidence when you do these treatments that is just incredible. And quite early on, I think that's what I found really exciting and really electric. There's one patient who always sticks in my mind who, and I still think back and I think it's so strange these people chose me and trusted me when I was maybe practicing less than a year. I'd, you know, have to really be confident, and I think, oh my gosh, these people are trusting me with their face. And this one woman came to the clinic and like could barely meet me in the eye. She'd been through some really difficult times, health problems. Her husband was unwell, death in the family. She, you know, was dressed in a way that clearly she just felt like she was struggling to really put herself first. Anyway, we discussed her concerns. Over the period of a few months, we did a few treatments. And I didn't see her for about 6 months. You know, and you see other patients and you think, oh, I wonder how they're getting on. And Edinburgh's a small city, so occasionally I spot people around. Never speak to them, but sometimes spot them. Anyway, she booked back in and I thought, that's nice. And by this point, it was quite a busy clinic. And I went out to get her from the waiting room and I genuinely didn't recognise her. And I still think about this. Like, she had like a full face of makeup on, totally different outfit. She had her hair done. She was off out to meet friends for lunch. And I'm not going to take credit and say that was me, but it was nice to see the part that these treatments can play in the kind of confidence journey of a patient.
Absolutely.
So I think when it all gets a bit stressful, then you have those moments with patients and you think, okay, this is quite nice. This is nice. This is why we do it, right?
Yeah, for sure. And I think that's such a big thing with aesthetics. Like, it really does give you confidence. Like, it's not even about, after a while, yes, you obviously go in there because you're unhappy with something about you, maybe. Or it could just be that you fancy treating yourself. But I think what it does, and the bit that you can't sell or explain, is the confidence that it gives you. Because looking in the mirror and being happy with the way you...
But that's the common trigger for everyone.
Yeah.
Yeah. So like, you might go in, like you say, because you're unhappy about something. And I try and move patients away from that. It's really sad. Patients will often come in and use quite negative emotive language about, you know, I hate my nose, or I really don't like this, or this really bothers me. And I always kind of try and make them take a step away from that. And I'm like, okay, you don't like this, let's park it, you know, stand away from a meter away from the mirror. Like, how do you feel generally? And it's usually I lack confidence, or I feel like I look tired, or I don't feel as good as I did going out with my partner or my friends. And sometimes not even addressing that one thing that they thought they were coming in with can make a difference to their confidence. It's sometimes that more kind of holistic care they get. Yeah. Even sometimes not having a treatment and just being able to talk to someone.
Absolutely.
And I say, actually, you look great. You don't need it.
You don't need it. That must be like the...
And they leave with a spring in their step. It's great. I get to have half an hour with someone and I'm like, I think you look great.
Yeah, no, absolutely. Do you struggle to say no to patients if they want something?
Not as much now. I think I used to. And I'll hold my hands up and say, I think anyone, if they say they haven't, would be lying in this position. We've all treated people that I think if we met further on in our careers, we'd probably say no to. When you get started, you're so excited to help people improve their confidence. You're so keen to say yes. And also you want to do treatments. You think, I've got these skills I want to use. But I say no definitely more and more. Yeah. And I don't struggle now. There's a way to do it. You know, it has to be done in a sensitive way.
Yeah, no, absolutely. And obviously we touched on you being a mentor, and you talked about sort of people that come to you now. So is that something that you advised people in terms of when you're starting out, being confident to say no?
Absolutely.
Yeah.
Absolutely. You have to... People remember, I think, integrity as patients as well. So there might be patients that come in with a concern that I don't think is bad enough in inverted commas, or, that's very subjective to each patient. But I don't, I might say this treatment's not for you. Maybe in a few years' time you could consider this, or go away and think about it. And actually, without meaning to, from a business point of view, often you've gained the trust of someone, a patient. Not that that's the primary driver for saying no, but if they then do go on to have a treatment, they'll probably come back to you. Equally, patients that are seeking out specific treatments might not have the right motivation for that. And being able to identify that and saying no is important, because what I've learned from experience is those patients are rarely going to be happy with the outcome if the motivation for treatment's not correct, if it's not the right driver. So there's a number of reasons why you might say no, but I always say to as healthcare professionals, we develop these really good spidey senses. And if it just doesn't feel right, figure out your way of saying no kindly and say no.
Yeah, I've heard that quite a lot. Like, you get a gut feeling almost like something's not quite right.
Just the motivation for treatment is not right. This person's maybe not coming to see me in the best headspace to make a decision about treatment, particularly if they've never had a treatment.
Yeah.
There's often triggers, big life events can be a trigger for coming in for treatments, and that might be entirely appropriate. But equally, if someone's lost a loved one, we've got to be really careful to make sure that patient's in the right headspace before going ahead with something. And sometimes they're not. Yeah,
no, this is really interesting. I think touching on sort of your background and obviously being in the NHS and all of that, do you think that's kind of given you almost like a superpower when it comes to understanding people? Because you've probably met a lot of people.
Not a superpower. I don't think anyone's got a superpower. I do think, though, my favourite thing about being a doctor is I'm just an incredibly nosy person. It's been said to me, I think all healthcare professionals are. It's such a privilege, to have a job, whether that was when I was in A&E or whether it's now in aesthetics, where I just get to ask people about their lives or the circumstances that have led them to being in front of me, whether that's the accident that's brought them into A&E, which might be some gruesome story that, is actually really interesting, or it might be the circumstances that's led someone to coming in to seek out a treatment. I think you get quite good at trying to figure people out. I don't know if you get better at it. And definitely, like I say, there's still patients that slip through the net that we maybe should say no to, but it's definitely a fun part of the job, meeting people.
That makes sense. And I think we'll talk about like non-medics, medics. That is actually always quite a big topic on this sofa, and not because anyone's right or wrong.
I'm sure it is.
But it's just very interesting to get people's point of views. And one of the things that I think is always an advantage from a medical professional is that kind of spidey sense, as you call it, like kind of not just looking at someone physically or not just kind of assessing them on a very surface level. You're thinking about their mental health, you're thinking about, the circumstances they've come from. Do you think that's probably an advantage that maybe medics have?
As healthcare professionals, absolutely. Absolutely. Yeah. It's one small part of a bigger reason why I don't think it'll be any surprise. I'm very vocal about this. Why I firmly believe that only healthcare professionals should be able to do these treatments, because there is an infrastructure that gives you, and that kind of is one part of it. Yeah. And that comes from the infrastructure we have of medical training, oversight, regulation, experience. Yeah. A collaborative network that exists within healthcare.
Yeah, no, that makes sense. And we'll talk about that a bit more because it is really fascinating. And I think, as I said, we talk about it a lot because it is, it's ongoing as well. I feel like it's an ongoing conversation.
Yeah.
Things are changing very slowly, but people are starting to maybe have more conversations. But I would say also as a patient, people are becoming more aware of the difference between someone who's medically trained and non-medically trained.
Not always. You'd be surprised.
Always, yeah.
There are some horror stories, but I think patients are becoming more informed. The flip side to that is, we were talking before we started about social media, the kind of misinformation that's there. So as patients are definitely educating themselves, doing a lot of research, but I think people are often not great at critiquing the source of that information. So where it's framed as a debate, between whether, for example, medics or non-medics should be able to inject, I think you legitimize arguments that really just are kind of underpinning unsafe practice. Yeah, is my opinion. Yeah. So patients are informed, but there is a lot of misinformation too.
That was going to be my next question, actually. Social media. So social media is, as I said earlier, off camera, blessing and a curse.
Yeah,
but how do you find it? Do you feel like it shapes what people come in asking for? Or?
It can do. Edinburgh, where I practice, is a funny city. It's quite I'd say it's still relatively socially conservative.
Okay.
So my patients are not necessarily coming in asking for the latest thing. Patients there, in my experience anyway, the kind of patients that come to me and, you know, the team in my clinic are coming in to see one person, and when we've got their trust, then they will take our recommendations. I know friends with clinics elsewhere have much more of an experience of patients coming in saying, I want this trending treatment. But we do see that, and a lot of that is driven by social media, which again, sometimes it's great because they know about a treatment that I might recommend, so they feel informed and safe and it seems legitimate to them. But equally, they might be totally fixated on one treatment that is just either medically inappropriate or is just going to be ineffective for them. So it's social media is definitely a blessing and a curse in that way.
It definitely is. And do you ever introduce treatments based on what your patients are talking about or want, or is it more what they need?
It's always going to, I mean, I'm never going to introduce a treatment I don't think is safe and effective. So it's always going to be, well, what concerns are my patients coming to me with? What can we do for them at the moment? And then where is there a gap in what we're offering in order to meet their needs? And then I will look at that gap, and then I'll think, well, where do the treatments exist that we can fill that gap with, and what are those treatments? And sometimes that's what patients are asking for, other times it's not. But I will never offer a treatment to a patient just because they're asking for it, because it's and I equally I'm not an early adopter of things.
Okay.
I know I've only been in aesthetics a few years, but there's a lot of questionable science around some of the treatments that are offered, and there's huge exponential growth in what patients are demanding, and also the sector itself.
Right.
So as healthcare professionals, we have to be really careful to make sure we're actually being healthcare professionals, driven by the science, not by the marketing or what our patients are begging us to inject in their face.
Yeah, no, that makes sense. And how early on did you start to introduce devices? Was that quite early on?
Yeah, quite early on. Again, that was a kind of gap in the practice. I quickly realised that whilst injectables are phenomenal and make up the bread and butter of what I do day to day, we do a lot of device-led treatments, but a lot of those are delegated to the therapists in the clinic. Injectables are amazing, but there's a lot that we can't do with injectables. So our first device was Secret RF, actually from Cutera, after a lot of research and a lot of trying treatments myself and my friends being guinea pigs for various device demos, which they all absolutely loved. That's what we went for. And since then, we've brought on another device from them. We're about to introduce our third energy-based device as well. So we definitely like them in clinic, and we find that they fill a gap for our patients. So we maybe introduce them earlier than some practices would. Yeah,
no, it's really interesting, because I feel like that answer varies so much between practitioner, because some actually start out energy-based and or like minimal injectables. Some are like still not introducing it yet. Some
I don't think there's a right answer. I think these are big investments, you know, and this is what I say to people that ask, people will often say, oh, what device should I get, if people are asking me for advice, for example. And I remember saying this to people, and the best advice I got, which I tell other people, is no one can answer that question for you. You have to think about what your patients want. So what was right for me is not necessarily right for someone else. But for us, they've been a real game changer, particularly, like I said, in terms of kind of opening the door to new patient demographics that maybe didn't want your traditional injectables kind of based aesthetics.
Yeah, no, because I think, like you just said, it's also where your clinic is based. Like you might have, for example, we work with a lot of different clinics around the country, but our clinics that do really well with energy-based devices, like sort of laser treatments in particular for resurfacing or, pigmentation, they do tend to be in areas that there are more people of colour, basically, because it's a concern, and it's like a top of their concern, versus maybe in the south it might be less. I don't know. It varies.
Well, for example, for us, I mean, in Edinburgh, the majority of our population are Fitzpatrick type 1 and 2 skin, so Caucasian. But I quite quickly realised that we didn't have a solution for them for the kind of redness that they get in their skin, which everyone Scottish gets.
Interesting.
Which was the reason behind us introducing our first laser earlier this year, which, as I said before, has been a really popular introduction to our clinic. So it's identifying, I think, what's right for your practice. And for some people, that's no energy-based devices. I've got colleagues with really successful practices that don't do any energy-based treatments because they just focus on injectables. For others, that's having a whole suite of the latest lasers.
I always talk about this one practitioner I went into his clinic. It's in Harley Street. and he had a room of just lasers. Like, but when I say, I can't even, I'm picturing it now.
I've seen some like,
I think it was like 50
mental,
devices.
but then that also almost makes me a bit sad because I feel like, but you've got these devices and are they being used? Maybe, you'd hope.
I have no idea, but it was just like 15, but I was like,
these are really expensive machines.
Yeah, and then I was trying to work out after. So you know what, you take it in and you look at it and you're like, wow, that's amazing. I recognise that one, that one.
Yeah.
And then I sat down with my colleague and we were chatting and I was like, I can't even tell you what, like I know all of those devices, but
what do they do?
Do quite similar things.
Yeah.
But then obviously, then you have.
But then maybe that's their niche, you know?
Yeah.
If their whole thing is energy-based devices and treating lots of different patient demographics with that, they maybe need that.
Yeah, I think as well their answer was obviously being in London, you have people from all different walks of life with all different skin tones, skin types. Like now I've got a laser for everything. Problem solved.
Right.
That is, I've just never seen, and it was the most ornate room.
That's never dream.
Anything like it.
I would love a room full of lasers. Maybe we'll get there one day.
Yeah, it was amazing. So let's jump to obviously your background in the NHS and A&E. Tell me about that. Tell me, you said you were drawn towards A&E. Was that was it because of, like, a lot of people say the adrenaline, it's like lots going on, it's different things every day?
100%. Yeah. I'm a very impatient person and I think I liked the fast pace of it. I liked, and I don't do very much NHS now. I do a little bit still because I still really enjoy it. In emergency medicine, I just like the fact that at the start of a shift, you never know what's going to come in the door and you might have some really wild, crazy, exciting stuff. Or it might be quite a boring day, in which case that's great because it means no one's been that unwell. But I always, when I was, you would speak to medical students or people thinking about specialties, I'd always say, I feel like A&E, you get to see the fun bits of every specialty. Yeah. But you don't have to deal with a lot of the boring admin that comes with that. You get to see them, patch them up and pass them on.
Yeah.
And you get to do lots of fun procedures, which I always quite enjoyed.
Yeah.
You know?
Yeah. And I guess the hours were quite crazy for you?
Yeah, but then that didn't really bother me. I've never been a 9-to-5 person. I think I naively thought when I went more full-time aesthetics, I've still got one foot in the door in the NHS. I'll have a much nicer work-life balance. But in reality, you go from working about 70 hours a week in the NHS to what feels like 24/7 for a business owner.
That's what I was going to say. With the business owner, you really are.
You don't really get any days off, which is fine. And actually, do you know what? It's the price you pay, and I love it. And I don't think you can run a business if you want that 9 to 5.
And what is it like having, as you said, like obviously I know you're obviously doing less now, but having one foot in the door at NHS, or when you were doing sort of half and half, how was that?
That was very difficult.
Yeah.
The point where it was about half and half was really hard.
Yeah,
I was very tired all the time. And it was hard. There quickly came a point where I felt like I couldn't give my aesthetic patients kind of 100%, which was quite a difficult realization. So when you work something like, as an A&E doctor in the NHS, you'll finish a shift and you'll go home and you'll be off. There is always doctors in that department 24/7. If you've got patients that are still waiting for things, as you always do, you'll hand them over to another doctor. You'll get to switch off and go home. Whereas in aesthetics, your patients are your responsibility all the time. And there were never any problems, but I just remember thinking, I feel like I need to be more available for these patients. So that, it was a hard decision, but it was the right decision to kind of leave A&E training. And now I just do the odd kind of locum shift because I still really like it.
That's good. It's nice. And I guess you probably enjoy it more because...
Yeah, because I can go and have a terrible shift and then I don't have to go back the next day like all my poor colleagues do.
Yeah, exactly. And then obviously boundaries are a big one as a business.
Yeah.
I think it's really hard to have boundaries. How do you find it? Do you have sort of your own boundaries and your own cut-off points in terms of... Because obviously being on social media as well, you're very accessible. How do you manage that?
Not well. I'm still figuring it out. I've definitely got better than I used to be. I think the advantage of growing a clinic and having a bigger team means obviously you can then delegate. Something else I have found difficult to do. But for example, I'm not accessible in terms of a first point of contact from patients unless it's an emergency, in which case they can reach me. But otherwise, everything goes through the clinic team. And so introducing those kind of boundaries, I think, have been really helpful. But I'm not sure if there's an easy answer, because when you're starting, particularly if you're just a one-man show, like most of us are when we start, you're doing everything.
Yeah, you are. You really are.
And I still feel like I am. I'll be checking emails on holiday and I'll be there on a Sunday night. trying to relax, but still, making notes. Something will pop into your head and you'll put it in the notes app in your phone and think, oh, I've got to do that tomorrow. But again, I feel like you can't be a business owner if you want the 9 to 5. Like it does just kind of come with it.
I think, do you know what, genuinely, a lot of practitioners that, maybe this is more of a dental, I would say, think that aesthetics is great for work-life balance, in the sense that, I've studied.
I think it can be great in terms of work-life balance, but I think running a business is no different to any other healthcare business. You've still got patients, and patients can be demanding, rightly or wrongly. So you've got to be available to them, and you've got the demands of a business. Any other business,
Yeah, no, absolutely.
The finance, the business side, the logistics of running, everything that comes under that umbrella. Obviously, if you want, there are ways to do aesthetics and have a great work-life balance. If you go and work at another clinic, then
exactly
great. But then like I said, quite quickly realised that wasn't quite for me.
Yes. And I think, do you know what it is, that it's people think, I'll open a room and I'll start doing it on a Saturday, but you've still got to book all those people in for that one day. If it's one day, you've still got to answer their questions. It's really hard when you don't have a team as well, because you are the team, right?
When they message at 10 p.m. worried about whether it's a bruise or a vascular occlusion, like, you've got to respond to that message. You can't be like, oh, it's out of hours, I'm not going to respond to you. You've got to reply to them and make yourself available if they need you. So it's definitely difficult. Luckily, that kind of situation isn't common, but I think people need to be aware of that when they go into it as well. Yeah.
No, on that, actually, one of the things we were chatting about on the sofa a couple of weeks ago with Dr. Jenny Doyle, who also works in the NHS a couple of days a week, or I think it's actually not so often anymore, but used to. She said one of the things she saw, particularly with the non-medic argument, was when you're a medical professional or a healthcare professional, if someone messages you with that worry, you jump into action, like, this is what we need to check, this is what we need to do, these are the next steps. But she found that speaking to people anecdotally, when they were non-medical, they would say you need to contact your GP or go to A&E.
Which is wildly inappropriate.
Yeah.
And having seen it from both sides, it's wildly inappropriate. So absolutely, patients turn up to A&E with complications from aesthetic concerns. I have seen it numerous times, as have my colleagues, to the point where I've done teaching for the department I'm in and other departments on, this is what looks terrifying but isn't. For example, if someone comes in with a droopy eyelid after some Botox, they're not having a stroke because of, XYZ. And this is what doesn't look terrifying but might be. But there is a common argument from often non-medical injectors that, well, doctors and nurses don't learn any aesthetics, at medical or nursing school, or dentists don't learn to inject Botox and filler, which is true. We don't. But what we learn is everything else that comes with being a doctor, a nurse, or a dentist. So I have seen colleagues manage aesthetic complications in A&E phenomenally well. Completely inappropriately, they should not have been doing that. But in that situation, that's what the patient needed, and that patient should have been managed appropriately by the practitioner. So I think it's that particular argument is weak, and I totally agree with what you said. Jenny Doyle had said, it's as a healthcare professional, you have your protocols in your head for dealing with those things, and you're able to kind of triage that. So when I get that, I get patients messaging with worries all the time. And you can reassure them and know when you need to act.
Absolutely. Because she put it into context, and, Jenny, I don't know how much you know about her, but obviously she is a surgeon as well. So she was in A&E, I think, or she got called into A&E out of hours, and she was like, this person had gone to Turkey actually to get a treatment, and then it had gone wrong, and the basic sutures had opened, and she had to operate, and it was quite bad. So out of hours, she was like, obviously a normal NHS, open a surgery, it's £20 a minute or something, she said, and it's like, out of hours, can you imagine how much that would cost? And there was no one for this poor lady to contact. She had to come to A&E. There was no choice.
I've seen, like I said, in A&E, but also people rocking up to my own clinic, phoning in hysterics.
Oh gosh.
Increasingly often, actually, more and more, with problems. And, I saw one woman not that long ago who had been injected with filler by a beautician, had developed what she thought was a vascular occlusion. She wasn't sure. She was calling a day later. So at that point I was like, oh gosh, okay. I mean, she also thought she had an infection. She wasn't feeling well. This person was refusing to tell her what had been injected and was refusing to see her and told her to go to A&E. But luckily she was fine. I had to see her about 5 times over the period of a month to try and fix what we thought was going on, because we had no idea what to inject into this woman's face. We tried to phone this beautician who hung up and blocked us. But the point is, a lot of non-medics will argue, clearly that person didn't care. A lot of non-medics, I'm not saying are out to try and harm people, but they will argue, oh, but we are trained to deal with complications. But the point of medicine is the grey area. Not complications don't follow algorithms. Yeah. And just like illness doesn't. So when something goes wrong, you need the skills as a healthcare professional to be able to look at that and identify the grey areas. Is that a bruise or is it a vascular occlusion? What's making me sway either way? What in that patient's relevant medical history is going to influence my decision to prescribe X or Y? What does my experience as an A&E doctor give me in terms of managing this situation? And you can do as many courses as you want as a non-medical professional, but that's not going to replace medical training and medical experience, and also the regulatory oversight that comes with it, which is a whole other thing. Yeah. And unfortunately it's just an argument that I feel like sometimes it feels like banging your head against a brick wall. So I have to be selective with what I engage with on social media sometimes.
No, absolutely. It's really interesting because for context for me, and I always tell this story, so I started out as a beauty therapist, and I had no intention of ever touching anyone with anything that involves needles or whatever. But I was trained in microneedling, and even that felt really wrong.
But that's not necessarily inappropriate, right? So as a skin therapist, there are a number of treatments, including some lasers, maybe, including, depending on what you're doing and what you're treating, that may be appropriate. With or without medical oversight.
Absolutely. Yeah.
But it's, in my opinion, it's never going to be appropriate to essentially perform what's a medical treatment. So either injecting prescription medicine or what's essentially an injectable implant into someone's face, let alone the whole, market now for vitamin drips and these other kind of
that's a whole
medical treatments that some beauticians are now offering. It's never going to be appropriate for you to do that with not being a medical professional. Can you imagine if someone set up doing fillings on the street and said, oh, it's fine now, I've done a 2-day course. We all did the same training as the dentist.
I hear a lot. We all did the same training. But I was then, I was doing microneedling, and I'm quite a nervous character anyway, so I was like, you know what, I don't think this is for me, not because there was anything wrong with it, but then I got approached with, oh, would you like to do the filler course that we're doing from the same training company? And I was like, oh no, I was like, I couldn't think of anything worse. If I'm getting stressed about doing microneedling, how on earth? Because do you know what came into my mind? It wasn't the treatment itself, it was what to do if it went wrong.
Yeah.
I wouldn't have a clue.
But anyone can learn a protocol. I say this, you can teach a monkey to inject lip filler. You could. Yeah. And the difficulty is that if you're a beautician by background or a makeup artist or a hairdresser or, all very skilled professions that need quite a significant degree of artistic skill, you are already well positioned to look at a face and know how to make that face look good. So there are some beauticians that can get a before and after with some filler that looks really good. It looks good. Yeah. But what they don't have is any medical knowledge beyond what they were taught on that 2-day course. And the real danger then comes with when that person doesn't have the awareness that you talked about. They truly believe that they know what they need to know. So when the people say we all do the same training, the real dangerous thing is when those people genuinely truly believe that.
Yeah, no, that's fair enough.
And then when patients believe it, because if the people are saying that to patients and the patients then believe it, when it goes wrong and they can't manage it, it takes them encountering what can be potentially a really horrific complication for them to realise that they don't have the skill and the knowledge to do that treatment.
And what's really interesting, I guess you'll see this more often, is that because you are a doctor, people who have had some complications or something's not quite right or doesn't look right, the first thing they'll do is seek a doctor.
Yeah, absolutely.
Yeah. So if you found that, I guess because you're very much out there on social media and you're very approachable, that you find that people do come to you in those.
Yeah, I get messages, asking for help and advice. And obviously, the caveat is I can never give medical advice over social media if I've never seen a patient. But if someone's saying, do I need to get this looked at? I'll probably say yeah. Yeah. And if they're in Scotland, I'll say, can you get to Edinburgh? I'll see patients for free sometimes. Wow. I don't advertise that necessarily because I don't have time to do it, but all the time. But like if someone's worried, I'd rather, and potentially there's a complication that might end up being something significant and serious, then they need to be seen. But the first thing they do is seek out medical attention.
It's interesting, isn't it?
So it's a beauty treatment. That's something I say all the time. It's seen as a beauty treatment until it goes wrong.
Yeah.
and then it's a medical problem.
Yeah, no, that's really interesting. We actually had a non-medic on the sofa, and it's an episode that will be out before yours, so we can't even really refer back to it because you haven't watched it. But it's really interesting because I wanted to ask the same question back, and yeah, the answers that you have said is what they would say, and it's really interesting. And something I really want to do is have almost like an open debate between the two, because it's such an interesting topic, and I think it does all come down to protocol.
It's the same arguments that come up again and again, and when I bring up those questions, I've never got, and I do engage, like I post things on TikTok and Instagram, and I post these things, and I get non-medic injectors in the comment, because I understand it, to a whole basically profession. Here's someone like me or a whole cohort of people saying that they shouldn't be allowed to do what they do. I get why you'd feel upset at that. So then there'll be comments arguing against what I'm saying. But with those points I've made, I've still never had what I think is a legitimate rebuttal.
Yeah.
And I'm genuinely open to it. I am genuinely open to it. I don't believe that there aren't people out there who are skilled at what they do and have learned those skills, and again, can make someone look really good.
Yeah.
But again, do they have the skills to substitute a medical degree and the regulatory oversight that comes with that? Well, of course they don't.
Yeah. It's quite scary when you put it in black and white like that. That's the bit that scares me the most.
And when you're talking about complications like blindness, know,
it's no joke.
When you think about the most catastrophic thing that can happen with a filler injection, it's terrifying.
It's terrifying. But you know what? I genuinely think a lot of patients or future patients, someone who maybe is in the early stage of looking for treatment, don't even think about that. That's why they go for price. They go based on price, and that's how they kind of end up.
Again, this is why it comes back to patient education. Yeah. This is why the right type of education on things like social media is vital.
Yeah. Yeah.
And it's not about fear-mongering. I've been accused of fear-mongering before, and I'm not, because the chances of any significant complications with an injectable treatment are actually very low.
Yeah.
But they happen.
Yeah, absolutely.
I've had complications. My colleagues have had complications. We all do.
Yeah.
So
that's how you manage.
And the question to a patient is, who do you want next to you when that happens? Do you want a healthcare professional, or do you want a hairdresser?
Yeah, fair enough.
If I get a bad dye job on my hair, I want a hairdresser there.
Absolutely.
If I have a vascular occlusion, I want a medical professional.
Yeah, exactly. That's a fair way of putting it. And that's really interesting. Obviously, I could talk about that all day.
Yeah,
I do find it fascinating.
On a tangent.
But as just sort of on my 2 pence, like just for someone who I love treatments. I get everything done. I try everything.
You and me both.
Yeah. Dr. Nabil, love him because he will be like, I've got a treatment. I'm like, yeah, I'm there. Let me try. But I am always thinking, I don't know if this is a good thing, worst case scenario. So that's why, honestly, it took so long for me to get a treatment done because of worst case scenario.
I have patients that have decided at the last minute they've changed their mind about having often a filler treatment when we've actually got to the point of going through the consent form.
Really?
Because of what some of the things on the consent form say.
Yeah.
Like blindness.
Yeah.
I hope to God that never happens in my career. Genuinely, I think it's the most feared, worst complication any injector would have. But then the patient says, of course, oh, but that's not going to happen to me, is it? And I can't say no. So if in that moment they can't agree to that, then they shouldn't be having the treatment. And the problem is, if you don't fully understand the medicine behind what you're offering, how are you consenting? You're not consenting someone.
Yeah, no.
You're not. Just like I'm not a surgeon.
Yeah. Yeah.
I wouldn't start having a crack at doing, Dr. Doyle's blepharoplasties because exactly. I wouldn't know the medicine and the anatomy and the risk associated with that, so I wouldn't be able to consent someone appropriately for it.
When you watch her episode, because she was saying that people do it.
People do it. There are non-medics doing it, there was someone in Glasgow doing it, who also then started offering genital filler. I mean, the mind boggles, but anyway.
It's madness, absolute madness. So I feel like we've completely gone off.
Yeah, we really have.
But I love it. It's great. So you mentioned Scotland. So this is really interesting because I don't know much about the protocols in Scotland and what's there versus what England are doing. I know England as a whole has a lot of work to do.
Yeah.
So basically my question was, Scotland seems to be moving quicker than England when it comes to regulation. What is Scotland getting right that England needs to learn from?
I think there's firstly been, this change has not come from the top down. This has come from the bottom up. It's really important to, acknowledge that there are very vocal healthcare professionals who've been shouting about this for years, long before I picked up my first syringe of filler. And there are, colleagues and people in the industry that have done much more than me in terms of advocacy. And that's where it's come from. I think the difference in Scotland is there are members of parliament there, you know, policymakers who've really listened, listened to healthcare professionals and also listened to patients who've had some horrendous experiences, who've then been brave enough to go and share those in parliament and in the, you know, in the media. And Scotland's listened to it.
Yeah.
Now, what they've proposed isn't perfect. Me and most of my colleagues think it does not go far enough in terms of the regulation they've proposed, but it's something.
Yeah.
And they've done it before England or Wales have. So
yeah, absolutely. I mean, we have a lot of work to do, and I find it really interesting, and I do question, is it because you mentioned it, obviously it's such a big part of the industry, non-medical professionals, that they're almost worried that there needs to be some sort of support for them? I don't know. I
think it's I don't envy any government in the situation they're in with the aesthetics sector, because we've backed ourselves into a corner, in that there's a whole industry of people who, if we are really honest with ourselves and do the safe thing, we're going to take away their livelihood. I don't for a minute want someone to think that, I don't think that that's terrible. Do I think you can justify prioritizing that over ultimately the safety of the public? No, I don't think you can. Just how if someone, again, had pretended to be a GP or a dentist for 20 years and you said, oh, but we're going to take away their income if we stop them doing that. They've picked it up on the job, you know?
Yeah, yeah.
People would go, what? That's mad. You can't let them keep doing that.
Yeah.
I think we've got to be sensible and safe.
Yeah.
But I agree, it's a really difficult situation. I don't necessarily blame the non-medical practitioners, because I also think they've been sold a lie.
Absolutely.
A lot of them. You know, they've been taught by people who, again, genuinely believe that they're safe and what they're teaching is safe. So, of course, they're angry and upset when the government and then all the doctors are coming out and saying you shouldn't be doing this. But you've got to listen to the people who understand it, just how I'm not a plastic surgeon, so I wouldn't claim to, you know, suggest who should and shouldn't be doing those operations. Obviously not non-medics, but, you know, there's a lot of kind of smaller debates within aesthetic medicine, plastic surgery, dermatology. But I think we've got to kind of recognise who we're listening to.
Yeah.
And who sees the problem. Yeah. And listen to them.
No, it's really interesting. And I think there's not every state in America, but there are states in America that get it right. There's some that aren't.
Yeah.
But I would say America's definitely closer to getting it right.
Most of the world is closer to getting it right. There's very few places in the world that would allow, you know, someone with no qualification, not even a GCSE, and no training to pick up a syringe of product and inject it in their living room with no legal repercussion.
Yeah, it is mad.
And people from the rest of the world, providers, genuinely can't wrap their head around it.
I've seen some horror stories on TikTok recently, like just videos of, there was one with this lady injecting someone in a car.
Oh, that went pretty viral, yeah.
Oh, I was like, what the? But even if you, right, okay, take away non-medic, just the same person, why would you want to do that?
Yeah, I think in that situation, there were probably a lot of bad decisions made by everyone involved. And the difficulty with that is I think you get quite clickbaity, polarizing opinion bits on social media that come from those kind of videos.
Yeah.
You know, so there'll be doctors that'll pick that up and go, oh my God, isn't this awful?
This is what
all these non-medics are doing, which of course it's not.
Yeah.
But at the same time, it's a good example of the shocking lack of regulation we have. But even people, you know, like I said, I've spoken to colleagues from the US, I've met at conferences and things, who are genuinely astonished. That's the first they've heard that we allow anyone to do this.
Yeah.
They just think it's crazy.
Yeah. It is really interesting. Love it. As I said, if we ever do a debate, you'll have to come on. I feel like you're going to be great.
So really, you'll have to hold me back, I think.
Oh, I love it. So obviously you've spoken about the explosion of botched treatments. You've been quite open about that. How do you think clinics can build trust with public confidence, so starting with your patients?
I think education goes a really long way. I'm often asked when I do some teaching and people getting started, how do I find patients? And I say, actually, if you can build their trust by educating them, that goes a really long way. So I get a lot of patients coming through the door of the clinic to maybe see me specifically because they go, oh, I've been following you on Instagram for a year, you know, and I trust what you say and I see you debunking all these things. So I think if you can educate patients in a very authentic way, that will build trust. And if they don't go and see you, hopefully they'll go and see a similarly qualified colleague. But I think that there is a long way to go in terms of public awareness.
Yeah. And we were talking about it before, obviously social media and how you're very comfortable to be on social media, but obviously that took a bit of time.
Definitely, yeah.
What was that process like when you realised you have to do this as part of your job?
Reluctant. A good friend and colleague used the phrase which you mentioned. It was that, something like everything you want is on the other side of cringe. And it's true. You've just got, no one likes watching a video of themselves or listening to it. Will I listen to this podcast? Reluctantly, but I know I'll hate the sound of my own voice. But you've just got to do it, and it gets easier.
Yeah.
And there's people in my team in the clinic that really don't like being on social media, and I have to respect that.
Yeah, no,
but I'm working on them.
Yeah, and why do you think it is so important now? Do you think it is that educational piece?
I think it's that education and also authenticity, you know, not to flip too much into a business mindset, but people buy from people.
Yeah.
And if a patient has got the choice between a faceless clinic without that kind of personal element behind it, without a personality of who they're going to see, versus someone who's putting their face to it and actually showing their life and what, you know, they believe in terms of their approach to maybe aesthetic medicine and the way they run their clinic, that might put some people off because that might not be the right person for them. But then the people that is for are much more likely to gravitate towards that.
I agree.
So I think it's important to be authentic, basically.
Yeah, and you were right. And I think you kind of touched on it there, a faceless clinic. Going in for a treatment can be quite daunting, even just the consultation.
It's such a vulnerable position to be in as a patient. Nice. You're going in and sharing insecurities and potentially having someone stick a needle in your face.
Yeah.
That's massive. Yeah. And we forget that as clinicians sometimes, you know. I have to remind myself, and I see patients that are really terrified. They've spent years working up to having even something which we see as innocuous as, you know, anti-wrinkle injections, Botox, for example, but it's a massive deal.
Yeah,
it's a huge deal. So I think having someone that they feel they maybe know a bit before they get there is huge.
That's it. That's why I always say to clinics I work with, and not so much sort of personal brands, but very much more clinics, you've got to get your team to be sort of front and centre, because even just walking into a clinic, if they recognise the receptionist or front of house, that does make them feel a bit like, oh, okay, I know them, or
make them feel more comfortable.
Exactly. And like having them have the treatments, like having your team have the treatments and filming it gives your patients trust, because it's like, well, if they'll do it, well, I'll definitely do it.
I'm so open with patients for every treatment I have.
Yeah, absolutely.
Yeah.
Like, I think
I understand practitioners that aren't, but I do think it's slightly strange when people aren't open.
Yeah, I feel like
as clinicians
are kind of a showcase of your work in a way. Like,
and your team definitely is.
Yeah, exactly. So yeah, I agree. I mean, that's always the perks of working in any industry that's like, whether it's, you know, aesthetics or dental, whatever. I think that you should be treating your team and your staff, because
you should be, but then it's that fine balance between me and some colleagues have got a very open agreement and pact that at the minute, if one of us starts looking a bit weird, we will say, because you go to these conferences and some people, it's that element of perception drift, you know. They didn't start out aiming to look like that, but over years and years they've started to look strange. So it's great having treatments that are really accessible to us, but we have to
put a break on it.
We have to be careful that we're not doing too much to ourselves and to each other, I think.
No, that's good. I like that you've got that. That's actually very good. It's good when it's someone who's not in your clinic and sees you all the time. Because when you don't see someone for a while.
It's at conferences. Yeah, we'll say you're looking a bit... And you know, I've asked, and I know that my other injectors who work kind of under me in the clinic are very empowered. 6 months ago, I was like, oh, I want a bit more filler here. And they were like, absolutely not. They were like, nope. And they were right to say no, because actually looking back, I didn't need it then.
Yeah, no, that's really interesting. Love that. So at Ignite, we always say that authenticity converts best. That's like our motto. Yeah. So how do you think your own personal brand helps patient trust as a clinician?
I think I'm just quite real. I try to be anyway on social media. I feel like aesthetics can be very polished and glamorous, and I hope I don't come across like that on Instagram, because I don't think I am like that. And I also think being honest about, like we've talked about, complications and not necessarily trying to scare people, but I think being upfront about the realities of the treatments when people then are ready to have them, I think means that they value that authenticity.
Yeah, definitely.
Over someone that's maybe shying away from talking about what can go wrong or what has gone wrong.
Yeah. And also I think it is a way of building trust.
100%.
Yeah. Well, I can say that you come across very approachable and friendly, which you are in real life as well, which is lovely.
Thank you very much.
So whatever you're doing, it's working.
Yeah.
But I think that's a big thing that we always try and get across to our team when we're like sort of talking to patients, talking to clinics or personal brands. Like, just get yourself across, because 99.9, I'll say 99.9 times out of 100, you will be a lovely person, and if you're coming across as this veneer, it can actually put people off.
Oh, definitely. You know, it's like we said, it's a really vulnerable position to put yourself in, and if that clinic or that doctor or that team or whoever it is that is the face of that business looks intimidating, then it's not going to put someone at ease.
No.
When I think about the times for example, I've got awful dental phobia, and I had some cosmetic dental work done earlier this year by someone who became a friend, and then secondly by someone who is a friend. And I was terrified, but knowing the person I was going to meant I felt I could.
Yeah.
Which is ridiculous given I'm a doctor, but like I will get so stressed even having like a cleaning. So it was a really good reminder for me of how important that authenticity is, and feeling like you're seeing someone that you know, at least in part.
Absolutely, I agree. So, having seen patients in both NHS settings and aesthetic settings, how do the two compare in terms of patient expectations and, I guess, vulnerability?
Well, everyone's vulnerable as a patient, you know, and as a healthcare professional, you're in a position of power, and it's important to remember that. And I don't mean that as a necessarily, you know, it's a good thing. It's just an important thing to be aware of. It's a real privilege because people are trusting you, but with that power comes responsibility, not to use a bit of a cliche, but so I think that's always going to be universal, regardless of whatever the setting, whether that was me seeing someone in A&E because of an injury, whether that's me seeing someone for a consultation for treatments. I think that the difference in aesthetics is people are coming to you people are coming to you with a motivation to improve their confidence, whereas when I was working in the NHS, I'd often see people on maybe not their best day, or God forbid, their worst day. And that's something I really like about aesthetics, you know, whilst there are stresses and once in a blue moon there might be a difficult patient, overall you'll finish your clinic list and it's been positive encounters, you know, and you've helped people.
Yeah, no.
Not to say we don't help people in the NHS, but people have come to see you because they want to see you.
Yeah.
Not because they've had to.
Very big difference, I suppose. And I guess no one puts it in this terms, but aesthetics it's private at the end of the day.
Yes,
right?
Of course, yeah.
So it's a private practice, but no one really says it like that. It's very much aesthetics, but it is a private practice. So do you think that's also a big factor in terms of the people that you see? Because obviously it's not a small investment, even if it's an injectable, it's not cheap.
Not a small investment, no.
Do you think that's why, in a way, it's like people are more, they come in more sure of what they want, they come in knowing that they want an outcome, or do you think it's just people wanting to be more confident?
I think it's the latter. I used to think it would be the former, but it's not. I mean, Edinburgh's, like I said, quite socially conservative. Our clinic is in quite a affluent area of Edinburgh, but we see patients from all walks of life. People will prioritise feeling confident at different stages of life. So it's really important as patients to remember the significance of that for everyone.
Yeah.
It's really important for providers to remember the significance of that for everyone. And we see people from all sorts of different backgrounds, socioeconomic backgrounds, different incomes.
Yeah.
And it's not, you'd be surprised, you know.
No.
The people that walk in and you clock the designer handbag aren't spending all the money.
No, absolutely.
Sometimes patients that you might assume would spend less in your clinic will really prioritise that investment in their confidence.
Because confidence is something that people always say you can't buy, but I think, no, you can't buy it in the sense of it's transactional, but it's a feeling, and there are different ways, and it might be, like you said, it might be teeth, it might be hair, it might be skin, it might be so many different things. But I think if you know what it is that is going to give you that confidence, you will invest in it, and it will come a priority.
100%. And I think our job as aesthetic clinicians is to try and tease that out in our patients in a responsible way and identify when a treatment is not going to do that for them.
Yeah. No, absolutely. And do you, within your consultation, talk about sort of confidence? Is that?
Yeah, definitely.
Yeah. So what does the consultation look like?
My consultation is about half an hour, but I always run really late. It's usually about 45 minutes. So my team tend to book them in a bit. And I just want to get to know, but I say to patients, I want to get to know you, but it's important that they get to know me. So I want to know what's brought them in, but they also have to understand our approach to treatment planning as a clinic. You know, I'm not the kind of person that someone can come in with a shopping list of treatments when they're on holiday in Edinburgh and I'll just do it. Like I don't want to see those kind of patients. And often we won't do treatment in the consultation. It's just a bit of a get to know them, you know. We'll discuss some options. They'll go in, have a think about it. Sometimes they'll come back for another consultation and we'll discuss things more. We'll have, you know, a chat over the phone. I basically just want to make them feel quite empowered. And often, like I've said previously, the treatment that maybe they thought they were coming in interested in is not what we end up doing, which is why that consultation is so important.
Yeah, no, absolutely. And I think, it doesn't matter really what they think they're coming in with. It's what they come out with, in the sense of, I feel like sometimes going in for a treatment can feel very like, right, I'm going to go in and I'm going to come out feeling really good and it's going to be, that's going to be the answer to my problem. But I love when I hear that practitioners talk about the person and actually kind of dig a little bit, because it could be more than that. And actually, I've been in that situation where I wanted filler and I went in and I was like, I want filler, that's what I need. And then I came out having Profilo and then did 2 of that, and I was like, actually, I don't think I need as much filler as I thought I needed. It's actually my skin that was the problem.
Or people coming in saying, oh, I think I need this. Well, why? Why do you think you need that? Oh, because your friend had it. Well, no, that's not a reason.
Because they look so good, but you might not need it. That's always what I hear.
You know, they're like, oh, I want to treat that. Or there might be something that's bothering them that they didn't even realise we can improve. You know, that's something we see all the time. Oh, I'm bothered by these lines. And I'm like, okay, when you look in the mirror, what is it that makes you think you feel less confident? Oh, I guess, you know, all this pigmentation on my skin. I'm like, well, what if we can improve that? Can you? Yeah, we can, you know? And to us, it's really obvious. But to patients, particularly maybe the older patients that aren't as active maybe on social media and aren't watching all the content that all of us are trying to churn out, they don't know what's out there. So they think, oh, I'm coming in for a bit of Botox or a bit of filler. But actually, there's this whole other world of treatments that we can offer them.
There is. As I said, I'm a sucker for a treatment. And it's not just because I genuinely just find it fascinating what technology and treatments and everything can do. It's amazing, like how far aesthetics has come in a short period of time. It's incredible.
There's a lot available.
There is a lot available, especially for, like, you know, darker skin tone now as well. Like that's a big one.
Absolutely.
Which is really exciting. So we're going to talk about a couple of sort of things that are around NHS, but I just wanted to ask this one question because I thought it was quite interesting. When patients come in with unrealistic expectations or requests, and you touched on this already, how do you bring the conversation back to what they need rather than what they want? What is that? How does that look like?
It's about trying to educate them.
Yeah.
So unrealistic requests, usually in my experience, are coming from a misunderstanding of what a treatment can deliver. So it's not that their request or what they want is unrealistic, but it's unrealistic in terms of what we can achieve with that treatment that they've got in mind.
Yep.
Or sometimes what we can achieve with non-surgical treatments, full stop.
Right.
And sometimes you have to be quite blunt with patients. The classic thing a lot of them do is come in and say, oh, I just want a really natural result and I just want this. And then they pull all their tissues back by 1/2 inch. And I'll say, well, that's a facelift. So I can't do that. So I think educating them what we can do.
Yeah.
And showing, you know, it's quite powerful to be able to show them before and afters of similar treatments. I'm lucky a lot of my patients will let me, you know, a lot of them do not want photos shared on social media, but they're very happy for me to show other people in consultations, which is always quite nice. But sometimes it gets to a point where if you think, I don't think this person understands what's possible, then again, that's a patient that I would probably, in a kind way, decline to treat, because if you don't think that you're going to be able to make someone happy, then I don't think it's ethical to treat them.
Absolutely. So do you think you'll always keep one foot in the NHS, or do you think that time will just not allow you to do it at some point?
I don't know. I struggle with this myself.
Yeah.
I'd like to, but it's definitely becoming increasingly harder. I'm really lucky that I worked or work occasionally still in a specialty like emergency medicine, where you can do, you know, locum shifts as a doctor and you can go in, and there are other specialties where it's much harder to do that. How long that's going to be sustainable for, I don't know.
Yeah.
I don't know. It's difficult. I hope for as long as possible, I guess.
Yeah, no, fair enough. And you've mentioned training and mentoring, and it's something that you're passionate about. What kind of practitioner do you want to help shape for the next generation?
A responsible one. and a science-driven one. You know, it's really easy. And I was definitely guilty of this when I started to come in and get, you know, blown away and attracted to the glitz and the glamour of aesthetic medicine, and, you know, take everything as gospel when you go to these conferences and believe all the new science behind things. And sometimes in aesthetic medicine, that science stacks up, and sometimes we need to wait a bit. So I think, you know, just reminding anyone new that's going into aesthetic medicine that they are a clinician first and foremost. They're a healthcare professional, and those skills don't magically vanish when you start doing aesthetics.
Yeah. Are there any treatments that were super or are super popular that you've been like, nope, not going to introduce, that's not for me?
Nothing that comes to mind. Like I said, I'm not a hugely early adopter of things, and I think sometimes there are trends. So, you know, there are certain treatments that might become super trendy because a celebrity had it, and then understandably because the company that maybe make that product, or the pharmaceutical company that create that whatever drug, or the device company that made that device, are a business, will capitalize on that, and then you'll get an influx of patients saying, I want this treatment because it's going to solve all my problems. So there's not necessarily one treatment that I don't value, but sometimes it's about really trying to educate patients that that one treatment that they've really seen hyped is not going to do what the press or the media or that other person on Instagram is telling them that it's going to do.
Yeah, no, interesting. So we're coming to an end, but I have a couple of questions for you. I said that already, but I do have a couple more, promise not too many. But we always on the show have this section that we call our Confessional.
Okay.
Where we ask you to tell us a story about, it can be NHS, it can be in clinic, it can be whatever. Just a moment that made you just go, patient story, crazy scenario. So do you have any that you'd like to share?
I mean, more than I could count from A&E, you know, from people running out the department naked apart from a hospital gown to the kind of crazy things people do that end up with injuries. But again, as part of what I loved about the job, and there's never any judgment with that, you know, we treat anyone that came through the door. In aesthetics, a couple of times, there was a patient who was brilliant, who travelled hours and hours to see me from as far north in Scotland as you can get, we'd done a virtual consultation before. I don't normally do them, but she'd got in touch and said, I want to travel to see you. She wanted full face rejuvenation with fillers and liked my approach. And I was like, yeah, we'll have a chat, because there's no point in her traveling if she wasn't suitable for treatment. And she was one of those people that I've only ever come across when they're a healthcare professional. And that's that as doctors, we love like gory things. Like we love, like I could lose hours watching, you know, those videos of someone removing ingrown toenails or cleaning out earwax or Dr. Pimple Popper, all of that stuff, right? We love it. It's kind of why we do it. This patient really wanted to watch me do her treatment. And I was like, no one's ever asked me that before. I was, are you sure? Okay. I mean, because usually I discourage people from watching videos of people having injectables because, for example, using a cannula in someone's face with filler looks really traumatic. It's actually not, and it's relatively comfortable, but it looks terrifying. But she wanted to watch it, and then she said, oh, I think my friend would love this. So then she spent about 20 minutes filming me do this treatment with her phone, and just loved watching it.
Wow. Imagine.
I mean, got a great result. She was like, oh, my friend's going to love this, was sending it to the group chat. I was like, it's the only time anyone's ever asked me to do that.
That is mad.
It's really odd.
I see a lot of treatment footage, obviously, in my profession, shooting treatments.
No one's ever wanted to film their own treatment.
I was going to say, our editor, bless him, is scared of needles, and a
lot of patients are, which is why I say, and I don't tend to post much treatment footage, particularly with injectables on social media, because I think there's a lot of people that wouldn't want to see that. But I love watching it, but I've got to remind myself that most people don't.
That's it, and I find it quite fascinating as well. I don't know if I'd sit and watch 20 minutes of it, but it is fascinating. But yeah, bless him, he has to edit it all the time. He's scared of needles. And how have you overcome that one? That's
yeah, but she was just not flinching, recording the whole thing.
And she actually went ahead with the full face.
Oh yeah, I mean, it was like an hour long. Full face, treated her neck as well.
Wow.
She was watching this cannula in her neck, filming it. Yeah. She was like, this is great. I was like, oh, okay.
Fair enough. No, fair. As I said, I've seen a lot. When you were saying cannula, I pictured it. When you said it, I was like, yeah, I'm there. I'm with you. But yeah, thank you so much for coming.
Thank you for having me.
And obviously tell everyone where they can find more about you and your clinic.
Oh, well, I mean, if you want to see my witterings on Instagram, I'm Dr Ben TD on Instagram, and the clinic is the Stockbridge Clinic in Edinburgh.
Amazing. And we always have to ask this question. It's the last question, I promise. Is the patient always right?
No. But we can try and educate them as to why that might be the case if they're not.
Love it. Thank you so much for coming on. Honestly, it's been great. And as I said, if I ever have that debate episode, I want you on here.
I will be right back on this sofa.
Love hearing the real stories behind the aesthetics, medical and dental industries? Make sure you follow us on Instagram and TikTok at The Patient Is Always Right for exclusive content. You can listen on Spotify, Apple Podcasts, or wherever you get your podcasts. And don't forget to watch the full episodes on YouTube. Hit follow, subscribe, and stay tuned.